it looks different. The hall looks different from here. Thank you so much to the audience here. Ladies and gentlemen, welcome to our second session from our conference. I'd like to welcome my guests. I have 5 guests. I have 3 of them here in the platform, and 2 are going to join us online. We are honored to welcome all of you, our distinguished academics, and we will discuss the Yemeni health infrastructure, its reality, the its challenges, and the scopes and horizons for reforming it. As you know, from 70s and 80s till the experience of non-centralization in the 90s, up to the almost full deterioration within the last few years. However, there is exceptional endeavors by some foundations, institutions, and even from some persons. And I'd like to remind my colleagues about being very cautious about time. And now I'm going to help you to manage time. We have 15 minutes for each to present each paper. And now we will begin from Dr. Najat Khalil, who is a professor of social psychology. She is an expert and field researcher about women's studies and gender studies, and also about Qat in the Yemeni society.
So thank you so much. I'd like to thank all of those who are worked hard to make this conference achievable for us. I'd like to thank all of those who came from Yemen for taking this hard trip. I'm within the health topic, and this is an honor actually for me. I'm not a doctor actually. I'd like to present a map for the psychological health in the Yemeni community, and even if all of us are suffering under these conditions, whether from those who live in Yemen or outside Yemen, of course, those in Yemen are suffering more. The psychological health is very important thing for part of our general health. WHO organization and the latest definition of health, they said it's not only to be that you have no disease, but also to live with prosperity. For psychological health, humans should be living some kind of psychological balance, emotional balance, and to be able to positively participate in your community. For us in Yemen, these things should be more important because we are living in an exceptional conditions. And since the 60s till today, we are suffering from continuous struggles, whether they are armed conflicts or crises, internal conflicts. As a result of these conditions, the Yemeni society suffer from being unaware of the importance of the psychological health for individuals in general. As I told you, the psychological health definition, as for the WHO, it is a case of psychological prosperity is to enjoy your life positively. For us, as I told you, this is not there. Everyone suffering in one way or another. The indicators of psychological health to be able to deal with pressures, emotional stability, but positive thinking, psychological healthy relationship, ability to make decisions, to be productivity, and to keep a healthy pattern in your life. I don't feel that all of us have all of these indicators. As for the history of psychological health in the Yemeni community, or in Yemen in general, I divided it in that way so we can overcome the problem of the limited time. In the 60s, that we consider the separate time after the revolution of 26th of September. In that period, we didn't have any services for psychological health. Otherwise, those who were dangerous were detained in prisons or in houses, or they are left in the streets. In the 70s and 80s, a psychological clinic were opened in the Republican Hospital in Sana'a, and a psychological hospital was established in Aden. This is in the 70s and 80s. As for the 90s, in the 90s we started to say that we need national standards for practicing psychological health, who made us a comprehensive study to assess psychological health in the country. At the beginning of the 21st century, we had some kind of advancement in providing psychological services, but not up to what we need. We had a big limitation from 2010 till after that. We adopted national strategy, a comprehensive strategy that included steps to enhance psychological health with the support of the Social Fund for Development. The impact of crises and conflicts, of course, it's a long topic to be talking about, but I will be only mentioning the main points. Since 2014 till today, we have high percentages, very high percentages. It is normal to have an increase in depression, post-trauma disorders, also anxieties after any bombardment or shelling. All of that affected the people. The mutual, when there is a shelling, also the deterioration of the economic condition, and also the impact of the war on the fragile categories, especially IDPs, women and children. The impacts of conflicts, as I told you, there were an increase of the spread of psychological diseases, traumas, whether because of seeing violent scenes or because of living that. Maybe by the last attack that happened in Sana'a, there was horrible scenes. We saw how remains were in the street. There was a high percentage of depression, anxiety, psychological also symptoms. I focused on the impact of conflicts on vulnerable categories, women and children. There are a number of studies that showed us that these illnesses that are suffering from when they are seeing the horrible violent scenes, they have this behavioral disorder because of the lack of education, displacement, separation from parents also affect children, and also the forced recruitment also have a bad effect on the children. Also, when they are released from service, also they face a lot of psychological problems. Also poverty, malnutrition. As a result of the economic deterioration, we have a lot of malnutrition cases, and all of these make children more exposed to physical and psychological harm. Also, the other vulnerable category, which is women. Women are more affected by war and armed conflicts. There is no precise statistics, but it was observed that the women witnessed an increase in psychological disorder, also domestic violence, early marriage, sexual insults. All of that was increased. The loss of the breadwinner also affected women, and for them to have more responsibility, the deterioration of the economic situation, all of these affected women big time. Also, of course, as a consequence, their psychological health got affected by that. We heard also that a lot of women, even those who work in organization, were exposed to torture, arbitrary arrests. All of these were happening against women. All of these affected the psychology of women. Also, the social stigma. Women like it is a shame or a stigma for a woman to go and ask for help, for example. And the reality, as for the reality of the psychological services in Yemen, we have psychological clinics within the general hospital, but they are so limited in number, and they do not cover the real needs of people. The services is provided in 12 hospitals all around the country, and all jails have some section for imprisoned for prisoners who might have mental problems, and only 10 specialists are serving in those prisons. The private clinics, we have a number of them in Aden and Sana'a, or in the main cities. These do not exceed 45 in number. As for the techniques of diagnosis, till today we don't have the needed tools and measurements in the Yemeni community, but we adopt a number of measurements, and we don't have official protocols to make the diagnosis that is used by the psychologist. We use the psychological cure or the medicines, and also we still use the treatment by electrical shocks, although it is not used now anymore in many countries. And we have also hotlines to receive reports from those who need support in Sana'a University, and we have the psychological and education or pedagogy center in Sana'a University, and we have centers supported by international organizations like UN Fund for People, for example, who is supporting a number of civil society organizations. As for the risks and the challenges, first we have the instability and the armed conflict, which is the biggest challenge that is affecting health, psychological health, the lack of resources and funds. As I mentioned before, most of the services provided in relation to the psychological health is funded by international organizations or donors, which is not sustainable. And because of that now, we don't have a fund anymore because some parties stopped their funding for such services. Although we have, as I told you, sections for sociology in Hadramaut, Aden and Sana'a universities. However, the number of specialists or psychological doctors is not sufficient, and they need the sufficient training. Most of the specialized training are in the main cities only. We don't have sufficient training and experience because we don't have any more programs on that. And the infrastructure is threatened because the health care infrastructures as a whole was destructed, and of course with that comes the psychological health centers. We have also the problem of the stigmatization and discrimination. To ask for help from a psychological doctor or a psychologist is a stigma in the Yemeni community, and the lack of policies and legislations in this regard. We don't have any strategies that protect the right of the people who are suffering from psychological illness, and most of the services are in the main cities, and they are costly because the cost is very high for such treatment. You have 2 minutes for the recommendations. Yeah, the recommendations: in order to enhance the psychological health, we need to have a peace, a comprehensive peace for all parts of Yemen, and in that way we will enhance the psychological health for everyone, increase or enhance or raise the awareness of people, develop the psychological services, qualify the psychological staff, provide medications and treatment in regard to the psychological issues, develop legislations and policies, activate the role of civil society organization, coordinate between all of the different entities, whether they are governmental or private entities. Thank you so much. You finished with 15 minutes exactly. Thank you so much. Dr. Najat told me a story before, and I took her permission to tell you that story. It is a very short story, her own story actually. I met her today at the hotel door, and she told me that I came from Turkish origin. My grandfather migrated to Yemen in the 20s, and I was born in September in Yemen. I grew up and lived my life completely in Yemen, and now I'm in Turkey. So I told her, now you got back to your Turkish roots. She told me, no, I feel like I'm part of the diaspora, Yemeni diaspora in Turkey. I like to share with you this great story, and I feel relieved to share it. And now let me move to the next paper by Dr. Ghamdan. Dr. Ghamdan, he have a PhD from Saarland University in Germany, and he has practiced in Brussels, and he has very great experience and lead many initiatives on pharmaceutical analysis in order to enhance the safety and effectiveness of pharmaceutical products. Thank you, Mr. Muhammad, for this introduction. And thanks for all the attendees. I only need my slides to be on the screen in order to be able to start directly. So let me now move to the issue of the medicine market in Yemen, and I'd like to focus more on the practices of storage and the quality of medicines and the smuggled medicines, because it is a real problem in Yemen. Before I talk about the Yemeni market, let me have a quick glance on how medicines were discovered and developed. We know that it takes a lot of phases, maybe up to 15 or 10 years. As you see here, we have first the studies, how it happens. So in order to make medicine, we need something that we call the CMC activities, which is an abbreviation for chemistry, manufacturing and control. In the past 10 or 15 years, we tried to have a medicine that is always available for the sick people. So anything we know how to make it, and we know how we can manufacture, from where we are going to get the effective material, and how we are going to make the supply chains. And when the medicine reaches the patient, it should be stable. It should be, then what would we mean by stable? By stable, we mean to be effective and safe. So we need a medicine that is effective and safe. So when we talk about on focus, let me not go much into the technical details of pharmacy, but I'd like to tell you how it is a complex issue that when we are making a new medicine, we need to fracture it first under high temperature, under strong lightning, in order to see how it is affected by the different conditions, and whether there is any poisonous material would be resulting from it, and that would take a lot of time from us. And finally, when we have this medicine and put it in some places, in rooms, when we have a control on the level of temperature and the humidity, and leave it for 3 to 5 years. During these 3 and 5 years, we make a lot of tests on the medicine to make sure that it is safe. These tests are repeated to each 3 months, then each 6 months, then each year. So in that way, we are sure that the expiry period for that medicine, for example, is 3 years, and we write on it the temperature of the appropriate temperature for storage, and the needed environment. And if it was stored in a different environment, then it is not the responsibility of the producer. Now we go to the Yemeni market. A lot of colleagues talked about data, and I think it is a title of this conference that we have a lack in data in Yemen. The last actually statistic I saw in Yemen was in 2019, and before that 2015. So as you see here, the Yemeni market is a market that is open for the whole world. We have medicines from all around the world. 41% of medicines are imported from outside of Yemen. Only 18% is made in Yemen. So when I look at the medicines that are imported from outside of Yemen, we import medicine from 61 countries in 2019, and some medicines come from countries who have high standardized monitoring system, or no, not like that. So we need to look at the percentage of the number of imported medicines in comparison in between 2015 and 2019. We witnessed an increase by 46%. And maybe in 2025 now we have more imported medicines, and from more countries. Gamda, if you are asking me, Gamdan, where are the risks now? I think that the risks of the medicine industry are 3 things. First, we have the GMP, the good manufacturing practices is the first one. If the company is committed to these things, and we have an efficient, effective, and safe medicine. But some industrials like Merck from Germany are very good, have the very good factories. Also, some, of course, national factories are very good. If we have an effective medicine, and then we have a problem with distribution and storage. So they need to be committed with the good distribution practices, but because of the war, because of the cut of the electricity, in some of the provinces, they don't have proper storages for the medicines. So even if the medicine is manufactured in a high quality, it will still face a problem during the storage step if they are stored within pharmacies or big storages or in hospitals which are located in remote areas where they have high humidity rates, for example, or high temperature. So to have a lack of monitoring from the higher authority for medications. So it is a big risk for the patients to be taking ineffective medicines. So these are studies that focuses also in that issue. Talking about hospitals that are about medicines that are not stored well, although they are manufactured with high quality. And the big problem now that the factories that are making medicines in bedrooms under the ground. So in some countries they have medicines manufactured under the ground. That means that the medicine is not of a good quality. Or even if you manufactured the medicine with a high quality and then it got smuggled to the country through the desert, for example. So to keep the medicine in the desert for 2 months, for example, that would mean that it is not effective anymore. Or if they are moved with normal bags, suitcases through air travel, also the medicine will be not effective anymore. So I don't want to go into much details, but in the medicines, we have something called the active ingredient in each medicine. So if we have capsules, but if they are not made with good mixing, then it will not have a good active ingredient in it. So if the percentage of the active ingredient was less than needed or more than needed, then we have this problem of the therapeutic when we have a small window. But this is not a very famous problem to have sophistication, but the most problem that we are facing, that the active ingredient is not sufficient or less than needed. Then the patient will not respond to that medicine. We see this thing famous with antibiotics. Antibiotics, we see some antibiotics include only half of the active ingredient needed, which would give the virus more resistance than rather than killing it. So it's not because of the mal-usage or the bad usage of that medicine, but because the percentage of the active ingredient is not correct. Also, we have something very important, which is the existence of some impurities within the medicine. So we allow some impurity in the medicines, but if the medicine is put in some of so we allow some of impurities that might have some side effects like toxic or something like that. But if it was in the wrong environment, it might witness a microbial growth or physical changes that will lead to less efficiency or to some dangers. So I'd like to, and I remember what my colleagues talked about and how they are working under difficult situation. So all of the literatures that I found, they were only in national journals, not in peer-reviewed ones, and we need more clarity in regard to the way we collect samples. So I hope that in the future, and we are open to help the Yemeni universities to work with them in order to collaborate with them in order to have studies with more accurate data. So these are a group of medicines that I saw myself in Yemen in 2021. These are medicines for cancer, medicines for organ transplants, for metabolic, for viral infections, and all of these were smuggled. And these are very sensitive to temperature. So this is a big crisis, actually. In the news, if we saw similar news, when we heard that news in Al-Kuwait University, hospital that was contaminated for medicine. The news says medicine kills at least 10 children in Yemen. The medicine was infected. That's not weird news for me when medicines are brought from resources that is not trustworthy, or when they are smuggled. As for the recommendations, yes, you have 2 minutes for the recommendations. The recommendations, first, that is very important for us to improve the storage and distribution conditions at all levels. It is very important. Second, to fight smuggling drugs and to prevent smuggling. Also, the authority of medicines in Sana'a, in Aden, both of them, I tried to see their capabilities and how they are working in the laboratory. Unfortunately, the laboratories in Sana'a cannot analyze biological and genotherapy medicines, and they are using only chemical analysis through aspirin and hormonal things. So we need for them to have personnel who are capable of updating their information and their skills. So from here, I'm saying let us cooperate, Sana'a, Taz, and Aden, let us all cooperate together to enhance the life of the people and to increase the capabilities of the scientific staff. And we can also provide them with the needed machines. Also, let's work with the academics because we need data, we need numbers. I worked as a journalist, not as a scientist, because I didn't have the needed data. So I hope from all of these who attended here to work together in order to make studies. If you don't have the needed capabilities, we can help you from outside of Yemen. And I hope that you hear me here. Thank you so much. Thank you. You have a minute, so let me ask you a question. For the GTP, what is the most dangerous phase? Storage or the internal in the airports or in pharmacies or during the transportation? If you need to import, if you are importing from a good company, then you will have a supply chain that is well done, because they will provide you or make the medicine reach you within the needed conditions, and they will guarantee it for you. So if you want to give a recommendation for Yemen for a realistic available solution within our current environment and conditions, I would recommend them to take special care about the storage the storage of medicines, because the travel might only take 5 hours. However, the long-term storage is more important. So thank you, Dr. Hamdan.
Now we move to our third paper with Dr. Zainab Al-Hamadi. Dr. Zainab is a dentist. She is a researcher at the University of Birmingham and practicing dentist in United Kingdom. Today you're going to talk about the forgotten medicine in Yemen. Bismillah ar-Rahman ar-Rahim, in the name of Allah subhanahu wa ta'ala. Thank you everybody, and I would like that this conference was talking about God, but now I am talking to you about narrative review about dental care, dental health care in Yemen. As we know that dental care in Yemen is established upon an idea that it is something commercial, including services, but most of them are private clinics. Thus, accessibility to the services in the dental health might have some limitations. We know that Yemen is going through a humanitarian crisis in all its aspects in the health sector. However, for dental care, it has other oral health is relatively neglected aspect of health plans. Oral health depends on in WHO as part of general health, but it is neglected in Yemen. There is a need to review the reality of dental services and analyze the challenges and inspect opportunities for improving them. Because this is a narrative review, I went back to all published studies from 2000 to 2025, so 25 years, and I depended on PubMed, Science Direct, so Google Scholar. I tried my best to delve and take any publication to include it in my review. I also focused on the studies about Yemen, about oral health, about accessibility to services and providers of service, and I tried to find some Yemeni reports. However, it was not possible. The WHO have a report about health services in Yemen. This was written into 2019, and it says that 40% of its children has caries in their temporary teeth. There is no explanation for the mechanisms applied to find these results, but the scary thing is around 8% of population lose their teeth at the age of 20. And this percentage usually we find in the elderly people. They also who talk about the national health system response. Unfortunately, the government showed no response during the 25 years. There is no specific branches for oral health. There are no policies special for oral health. Thus, if the state is like this, I'm sure that problems are multiple. The Also, according to my narrative study, according to other studies other than WHO, the caries among children between 65% to 96%, and all studies prove that all children suffer from some kinds of gingivitis. It means that when they have gingivitis, advanced stages of it, a child will lose their teeth. And this is more problematic when the children have some disabilities, like children with Down syndrome or special needs, sorry. And there is a study also in one orphanage showed that the percentage of extracting morals is very high. And of course, we say that these teeth are temporary. If a person suffers from pain, they would understand how it affects the quality of life. With tooth pain, a person becomes unable to sleep, unable to eat. So it has a very important, it plays a very important role in well-being of a human being. I didn't, of course, show a picture of a person who's consuming cut, but this is his a mouth of a patient who consumes cut. And the problem again, there is no single study in Yemen that studies the relationship between consumption of cut and dental caries or cancer, oral cancer. However, there are other studies in different countries, other countries. Studies are very rare, especially talking about cancer. Uh, there is carcinoma of, for example, it's deadly. Actually, it's deadly. But there is a relationship on gingival retraction and the loss of teeth. And there is a very intimate relationship with the cut consumption and gingival pockets that results in odor, mouth odor, and loss of teeth. Unfortunately, there is a lack in initiatives from the side of government. The protective oral programs is almost zero. There is nothing. There is no any studies or reports talking about preventive oral health programs applied there. Because the government has not prioritized oral health, and the other one is that we lack branch for dental public health in the Ministry of Health, and staff also is not there. We don't have a staff, but the gap, the terrifying gap that there is that surveys of Yemeni dentists revealed the significant gaps in knowledge and practices related to oral cancer screening. So they know, they have information about the cancer, but when they actually examine the patient, they cannot recognize if the patient really has cancer, oral cancer or not. It will be, unfortunately, discovered in later stages when it's too late. And about knowledge uh, uh, among children, students' knowledge and practices, moderate knowledge among school students about oral hygiene, but visits to doctors are often due to pain rather than prevention. As we know, in Europe, every 6 months they should go for a checkup. And if they are and also weak behaviors among medical and dental students despite theoretical knowledge. The study focused on brushing, on teeth brushing, and applied it on a number of students of dentistry and students of medicine, and their oral health was weak, and this is the problem. And also, we have another issue about the dentist, about service provider behaviors, poor use of fluoride and prophylactic fillings, because these things prevent from caries. Some of them did there is no reference to the reason behind this, not using these preventive measures. Also, good knowledge of SDF, but limited use due to tooth discoloration, low use of modern techniques. Also, some challenges related to infrastructure. Public sector doctors' salaries have been suspended. Most doctors are based only in cities. We know that we have a huge number of dentists, of medical doctors, but unfortunately they are concentrated in cities. Difficulties in transportation and access to health centers in rural and remote areas, and also services in private clinics are expensive. And as for the impact of conflict and crisis, and my words here are based on research. Sharp decline in service provision after the blockade. Also, many clinics have stopped operating due to lack of resources. Oral health is not a priority in humanitarian response. A clear link between oral health and other chronic diseases like diabetes and other illnesses. But anyway, we still have a chance. And the first one of these chances is the adoption of minimally invasive techniques such as also that we have that we should have database prevalence of caries, dental caries, or extracted tooth, or other things. So we need to connect personally, get in touch. Of course, the government, SANAD, and other things might have sensitivity in them, but to provide some research based on our communication and come up with a database, because institutions don't give any support if you are not based on data. And coordination with universities in research to produce comprehensive and published studies. We need to have an access to these universities and help each other to do some research related to Yemenis themselves. For example, master degrees, instead of to focus in the master on things that will be beneficial for the country. Also, we need to gain support from the United Nations development programs, as Abian and some rural areas, they have applied some programs. So if we have database, we can point at the places where there is a lack of dentists or dental clinics in order to cover some of this lack. Thank you so much. Thank you, Dr. Zainab, and because you went on time, I want to ask you, you mentioned the gap about knowing or putting a diagnosis for cancer, oral cancer. So where is the gap? You mentioned about the response from governments is almost zero. Doctor, because you are in Europe, but I have nothing to do with dental care. Yes, I know, but about the OSCEs, we don't have this implemented in dental education, whether in private universities or public universities. How to educate the students to practically implement their knowledge. So it goes, then the skill, you mean that the skill starts from theory and then goes to be implemented. Yes, the theory is there in Yemen, but they cannot apply it, they cannot implement it, they are not actually trained to implement their knowledge. If I see the early stages of cancer, they are asked to give an early diagnosis for cancer to save the patient. Now we will go to to Australia. We have Dr. Kamal Hizam from Australia, please. He is a researcher about medicine in Taz University, and now he is a researcher in immunology and stem cell therapy at Taz University, especially in the context of the challenges, international challenges, and medical challenges, and we need to benefit from his experience in Yemen. Assalamu alaikum, peace be upon you. Welcome to our research, and thank you so much for Karman Foundation for hosting such an event. We hope that it will reflect by benefit in reality, and thanks for all volunteers and organizers who devoted a lot of their time and efforts in order to for this event to be successful. I'm talking to you from Canada, and I am a researcher in immunity and stem cell therapy, and this was my PhD research about stem cell therapy in some of the diseases, and I work also in the University of History in Sydney, and I published and co-published more than 71 research papers, and I got a prize about scientific distinguish from Peking and Nankai in China. As for my subject, I'm going to talk about scientific research in general and the medical scientific research in particular. And what I'm going to speak is just a continuity of what Dr. Mohammed Al-Dubai has started talking about, and his speech was very touchy also for us. And I want to step into the subject immediately. We are all here researchers, and it's pointless to talk about definitions that we all know. I just want to ask about how can we use the research, scientific research, and it's very important to use reliable data, reliable means of communicating people's issues, and documenting scientific report on the repercussions of conflicts on Earth is very important. Scientific research opens bridges of cooperation to kill tensions and prevent needs from platform to dialogue and operation with world institutions. So crisis becomes materials for research and development and not just strategical events. And we have examples from Germany and Japan, and when they suffered a lot during World War. Publishing scientific research give a prestigious in a prestigious journal gives an idea that this country from where this research comes is still capable of doing such a things, and it also provides information about the challenges that we live there. And also I will provide you some practical applications for employing scientific research in improving the development reality in Yemen. Yemen, according to some research, is one of the most suffering areas from health deterioration, especially in Al-Hudaydiyah. Then also it draws attention to regional problems of also to measure some of the problems also, and identifying problems of some research centers, also politics, economics, social challenges, and other things that were touched by our professors. Then what I want to say that putting all these issues in numbers is very important. The research is needed to find reliability, and in our country maybe a small laboratory is more important than the most complicated political issues, because it draws attention of the whole world. One research to discuss a problem, a health problem. And let me give you an example. In the suburb areas, urban areas like in Yemen, sometimes we have sicknesses in which the whole family, for example, can become ill. It's not very complicated to plant the microbes responsible for it, and to identify which antibiotic is good for it. It is not costly. It might not exceed $1,000 to have samples from a specific area. So what are the targets of this study, or the methodology used in this study? For those who are interested, they can find it in the research. Now let's delve into the first part of the results, of course, away from the reality, the sad reality, is to analyze the productivity of research of the Yemenis inside or outside in the diaspora. This production of research of Yemenis is very good, actually. Since 1990 till the end of 2024, we have around 3,797 documents as published researches. The first affiliation was more than 50%, and the percentage of publishing raised 13.5%, and a lot of them have a good number of citations. In addition, the international cooperation with the Yemeni researchers caused 79.73%, which means that this is collaborative research, and also the productivity of research is then depend on cooperation. Also, the universities cost 52% of the research provided. And this diagram, this picture in front of you, shows you the increase since 2010 of research, especially in 2020. The number of researchers and academic researchers jumped up, and one of the reasons is the immigration of a number of academics abroad. In addition, the recommendations, we know that there are some recommendations from the Ministry of Higher Education, and also they have recommendations about the researchers, and also the number of the withdrawn research is very limited and low, and it says that our name in the research is still good, and we have good reputation in the research, and we know that this productivity is more than what we had expected. Here, let me mention to this very shortly. Now, research in general, but 27% of respondents were from medicine school, which means the highest percentage of respondents from medical schools. I mentioned to the journals in which the research are published, and also the Yemeni institutions who have published the most. Sana and Taz are most productive in research, and the specialties there are different and variety of them. Medical sciences also, they have good productivity, and then we have also some engineering conferences in Yemen that provide good research. As here in this diagram, it's an analytical diagram about the activity, research activity in Yemen, and we said that it witnessed an increase within the last few years, and it shows the also again about the increase of the productivity, research productivity. Also here is an analytical view about the content of these researches, and as I mentioned, most of them are about medical sciences and engineering sciences, and I want to mention that these words also mention the fields in which these researchers are about, and there is a limited number of social studies or social sciences, and these are a list of the countries in which there is a cooperative work with the Yemeni research. So, of course, Malaysia, Saudi Arabia, Egypt, China, India are the most cooperative countries with the Yemeni researchers. And also you can see the universities collaborating with the Yemenis and the kinds of cooperation. As for the challenges faced by researchers, and this is very important, of course, each one of them is just a full question of research. The impact of the conflict on the performance of research task, more than 80%, 0.5. And this is one of the challenges, the most important challenges, especially those who are abroad, if they do not find support, lack of local grants in regular purchase and maintenance of equipment, non-transparent administrative procedures, unavailable research supplies, poor internet services, lack of adequate supervision or guidance, lack of sufficient training course in banking restrictions, personal safety concerns, lack of access to scientific journals, lack of access to basic equipment, lack of research ethics committee, unstable electricity, lack of equitable opportunities for female cadres. Also, we have some challenges, barriers related to funding and management of official institutions, also lack of having workshops, specialized workshops, and this is about policies, research policies, and coordination between state institutions and the research centers, on the sense of coordination between government facilities, universities, and private sectors. 82% think that there is no coordination, and 17% say that there is coordination. Another diagram here about motives for cooperation between researchers abroad and researchers at home, career connections, and others. Now, this is the important thing is about recommendations of this research, financing and investment in scientific research, allocate an independent budget for scientific research within the state's general budget, also encourage the private sector to support applied research projects or to eliminate or reduce scientific publishing fees by concluding agreements with open access journals, strengthen the financial independence of Yemen universities, activate and attract scientific endowments to Yemen universities and ensure their proper management, develop the research infrastructure, and this is a very important after ensuring to activate scientific endowments to Yemen universities. And if we look at neighboring countries in Saudi Arabia, for example, scientific endowment is one of the very important supplies for the fees and funds for the universities, also scientific data and journals through a unified national database. Also, we have enhancing research stability and governance in order to also establish centers for scientific research that are independent financially from the university itself. Also enhance and empower the research stability and governance, developing human capabilities and building competencies. You mentioned a very important point that for each 14 papers you have one writer or researcher. How can you explain that it is all collective, or how do you explain it? This is simply that the researchers don't finalize and cannot continue the research because of lack of support. Researchers cannot complete their researches. Yes, individual initiatives stop because of lack of fund. And these are also the reasons you mentioned in your paper, which is a valuable paper that builds up on what we have been speaking about in the morning, early morning. Thank you so much. We ask you to stay with us online, and because when we finish, we will open the for questions and answers. Now from Taz.
Doctor, I don't know how to introduce him, Dr. Abu Dhar Al-Janadi, and we can read it Al-Jundi. So he might be Al-Janadi or Al-Jundi. Is he with us? Dr. Abu Dhar is Al-Janadi or Al-Jundi. He is Al-Janadi from Al-Janad. Yeah, I know, doctor, but I said that on purpose. So he is a heart and kidney transplant center in Taz. He's a specialist in that in Taz. And he is now a professor and a consultant in the cardiovascular, and he's a cardiovascular surgeon and kidney transplant expert in Taz University. Dr. Abu Dhar, the mic is yours. It is a great opportunity for me. I wanted to be with you, but I couldn't come. And maybe it will show you the suffering from inside, and let us talk about how we are providing the medical service in Yemen, and it is a message to those here in the conference, and Al Ghafuri said when the science comes, the jinn goes away, and I will tell him now, we will impress you to show you our experience and to talk very quickly about what we had before and what is the situation now and what we want in the future. This health in Yemen was not as a result of the current crisis, but before. In 2002, we have 3.7% as for the health situation. Humanitarian development was also deteriorated in the past years. So it was not because of the war, but it is of the way it was managed. Since 2010, the patient had to pay 80% of the cost, and I don't want to talk about the cost. It became 7 million and then 20 million, and now 20 million is the cost. With the worst humanitarian crisis that happened in Sudan, Syria, Afghanistan, Yemen, in the number of the heart strokes was 33% of the reasons behind death. So we are going in this, revolving in this vicious circle. And in order to solve the problem, we needed to describe the problem first in details, and then we do not work on the solution. We rather ask God to solve it for us. It is the famous story of a cow and how to make the cow pour the milk, while the cow needs the grass and the grass needs water, and the water comes from the rain and the rain comes from Allah. So we are going with this vicious circle all of the time. We had agriculture being deteriorating, and then we had no manufacturing of milk, and that led to the malnutrition of the mothers and then the children, and in that way we had a vicious circle again. So what is the problem? If we have a chronic problem, that's what I wanted to say at the beginning of my words. If we thought as Einstein did, we think in a different way when we want to solve the crisis. So we want to change our mind and to think out of the box. So we started to talk about the situation, health situation, health in Yemen. Why? Because we have rehabilitated. The lack of rehabilitated or qualified hospital led to the lack of the existence of an effective health service being provided, and that made the donor lose their trust in us, and so that's why big amount of money has been leaked to outside for the people to be treated outside, and that led in turn to the deterioration in the healthcare education, which increased the problem of the health services in Yemen more and more, and that led to the more scarcity in good equipped hospitals. So this is a vicious circle. So what happened? Then we need to break this vicious circle and to provide a good model in this field. So now we will take you from Great Istanbul to Taz under Cairo. So this is the center we used to work in 2020. It was built in 2008. And during the stage, they said we cannot make it work because previously we used to describe the problem and not solve it. So it is a big hospital, a big center with five stories, but from inside it was not good. And after the war destroyed the whole center by shelling and bombardment. It has been destroyed since for years in 2021. And now, in order to create a good health for the people of Yemen and to live good life, we need four things in the health sector, which are the staff, the building, the experience, etc. So after describing this problem, and we are very good at problem description, we started to think about providing health services to the patients where they participate in, and then I convince the donors. So the patients, if they paid some money, I will have more patients, and I will enhance the building by getting money from patients. And uh, that project started by 2021. We started with heart surgeries, and we started with open heart surgeries, and then we made the first kidney transplant, and in 2024 we started off having this shared surgeries, and now we are preparing ourselves in 2025 to the liver transplant surgery. So what I want to say that we have them people who inspire us. Actually, I don't know this doctor. We visited many countries, and uh, we traveled the world, but these were the closest one to us. We applied the things they talked about, that they have in the Narayana health. We applied all of the 5 steps or 3 steps they talked about, and then we had the policy that we called the reversed pyramid. The reversed pyramid, that we would start with what we have between our eyes. So we started with the easy cases that they do not need follow-up. So we started with open heart operations with 3 rooms, and then other doctors got encouraged, and we got to make more operations. And then we got the echo device uh, and the x-ray, and then we had 120 patients a day. From where we got this strength? From the patients. If you look at that patient, we asked them. That made us work with the team. When we looked at the image, that patient was about today. We made an operation, heart operation, for him. We exchanged for him the heart, the heart uh, valve, and then so we take our strength from the patients. We need a lot of fund. We always talk about funding, and we have a theory that we call we always have a solution. So we have the bureaucracy of the government. Of course, we have a very good state, a very good ministry, because we don't intervene in policy. We care about research, about science, about training. We established a cardiovascular national institution to help in treating heart diseases, and we had that increased NGOs to support us, like this Save the Children, like Qatar Charity, like the Red Crescent. All of them started to support us more and more. And the center now includes 7 real programs, and all of the doctors say that the doctors have a lot of results, more than they expected. And we have supervisors from Germany, like Dr. Mahdi Al-Qadiri, other supervisors from Germany, from Saudi Arabia. We have different supervisors. So we open the program, and then this is a number that is now in the center, and maybe in the future we will have hundreds of doctors. So what is our scientific program or activity? Currently we are now publishing in the American Journal, and they selected the topic, which is an aperial case. So this journalist, so the first kidney transplant in Yemen was published in Tyler, and then we had more subscription in the trials, and now we published a letter in the risk factors, and so we have 10 articles published this year, and maybe in the upcoming years we will have 16, or the next year we'll have 16 articles. We started to transplant kidneys, and we provided 220 medical services provided all around Sana'a, and Taz is also trying to help people, and I hope that all Yemen would bring hope to the whole area. Also, we made screening for schools. We visited students of schools, and we visited more than 4,000 students. We visited more than 400 students, and we found that they are suffering from high rates of rheumatism, and we will now give recommendations to the Ministry of Health for that regard. And in Idi, in Haggaw, that is besieged, we have a 4-year-old child who suffered from kidney failure, and he had the opportunity to go and to make kidney dialysis in Saudi Arabia. But then they heard about this center. Of course, we did not know them before. And then he is 7 years old. He is a source of our inspiration. So I asked the parents to bring him directly to our center when they contacted us. So he, with his father, came to the center, and in the center, we made a kidney transplant for him. After a few years, he regained his health, and now he's able to laugh, walk around, and now he's about to go back to school. And he always tells us, I will become a doctor in the future, and I will become a kidney specialist. 100%, I'm sure he will be able to achieve his dream. Our dreams will be achieved. We have
a goal for 2030 to rehabilitate this hospital in Yemen. Thank you so much.